yan edin pa eyi if you say or so that do so sa for unkwana nyina nya dia eda fam kura tine pese ka ho asem ne ye pese sa hwe end of life decisions nipa wo hwe diwe yakopon boy a bone e ba ye ntem no edu wo nso no e ba ye ntem enunti edipa da sebo a da kubi no e de enyina no ye beko se Kristo maaya itna enhye bay na wo se ye awo ya pomodin ho se bre bi du na se yemfie kwanimu ana se yare bi we nso se yare no kwanimu a enhye bay na wo ho a wo se ye Ghana fo no ya na ini saa de ho adesua kese abofo de omo ho adesua pa ye na ho behia se saa end of life decisions o se ka ho asem na yenso no yehu de wesi bitie se de be ya e be to ye no ma ye adaachi bi no ye ma ne ye busua nso no antete o de bi ho anase bi nkwa daachi bi no yenso no ya antete ewe ye yale wa emu nti saa no manoma yi bi enom bi ekeka ho ne ye beka ho asem nti abra ye nchen ho kra no mesre ema eda NS champon pato eda so wala isu a enko bompaye edi dwumadie anim amaye
ayo agidi for misrem momre makuma ase ba bia mo bia na madaroma momi enfa ye ho hye onyame nsa osro ni asase yofo na onyame meda wiai e dia ye ni nkamfo ni aseda na mawuti na otwi mu wadam a doctor for bebrebe ya asafo ya maso ami ye hunu se uye onyame nwanwani ampa in fact nsema ya tene ya sum e kire se ye tiasia e wadom ni wobasa na de ye ho afofie nti awie ye da ho ase ye srawo e de ye ho ahye wadom basa ase se bra ye to awie dwumadie so titiw no ndan nsema ye beka no muodu nipa wo krankron ya de abrabo ba ne se wo mmerɛ aso sɛ wɔdasani firi wie mu yase nkomo ban ne sɛ wɔne na busuafo transidie we ne nyina ne yɛsɛw sɛ adɔktafo a wombedi anim ame atɔkɔ about these issues yɛ do mo hya wo nsa so nkokwan so
amen
sama omo nyansa mu oduro na mo omo kasa omo kan yɛ bɛte ase wɔ yɛ kasa mu na aboa yɛ ame asesa yɛ abrabɔ e okrodua yɛ timu mu ɛnɛ sɛ de ama asema yɛ te ase no yade a yɛ hunu no obi ase mu nyina kyerɛ sabone na aba timra wo ma epe ahoden yesrew se ma ahoden so ye nya ibone wi ne ntra wo nwuna se na wo nhira ne wadom ne yatra asafo ma mo nya ma ala iso anwembre ye de mo nyina hya wo nsa se kaka mo na obi a meka yensa na awie edwumadie enkwani mu na nya nhira ama adokafo a wo be kyerɛkyerɛ ye ne atiefo a ye betie so e wo Yesu Kristo di mu amen
Amen.
amen opani de wasipi ende awie nipa ye betene nka ewe dwumadie mu a obedi animu ene ya disuan eye Dr. Priscilla Owusu-Frimpong msebiki no edi kan no ona ode ye hya ase ene nso no ode ye ewie sebika bedi ka aka no dwumadie no obomu aso odi mu akotene pa oboa ye manya doctorfo be kan ye ho emetim dwumadie ebai ewo nibremu ti edenase na misai kai say no nkwan wala yiso ne doctor form ne kasa ye nyina no mama te say ne omuso be bala yiso 3 o'clock na omone abeye ne adesua no ta brad Dr. Priscilla de na no besi no yesem bisa eba no efa de na ye kan na yi ho no nke say bibi so kire wadwene wiki mu a ne so no kwan da ho say ode wasem bisa nso no ebeba na mtene safa kwanya yiso na meka se ye madofo mu nyina so akwaba na meka registers no obi ne na ma etwisi so se senye ye nkwa na yetie nipa bi free Canada a omo so etie eye edawotin Nami inshira onne abusuafo mo Canada nyina munya daage bitie program nyankopon hyiam. Bisam nyaменtie se nipa biso efri Ghana ano mo so no eba live so ne be ya desua. Ghana fo no nyina so nyame inshira mo. Namsam nyaменtie e ma me Patricia Bibio a o UK ene UK fo a mo so ba live so mo so ne be ya desua ne nyina no nyame inshira mo nyina. Ene asafoma ene adofo a mo so betie nyame inshira mo. Ene Dr. Priscilla Owusu-Frimpong. Priscilla, so do live so a kabeso video no amaye. Hello. Oh, me too, Hotino. You talk.
All right.
Oh, okay. That means now be. In fact, unu run ebushafo ni na mu na maya de. Yes, mama boa madwumadie no akọ ma pa so na me hwe no pepepe. You say wiki mu the course ha ma adwene. E mu text messages. Nyame inshira bu pi. Na sa video bi je mma wo. Nyakopon ka ho dwumadie mu. Amen.
Amen. All right. Judy for me, my Obia, happy Sabbath. I'm share screen. I'm say host and I disable screen sharing.
Okay. Patrick, the values also a cabit mind co-host Amamia. So be waiting me sharing screen. No. Patrick, maybe a few minutes. I'll be your co-host.
Okay, no problem. Okay, yeah, that's it.
It's about a few minutes. If maybe a friend Nakasa now your co-host.
Hello.
Hello. Yeah, Patrick, which may I Dr. Priscilla, a co-host Amami. So with machine screen.
All right, no problem.
You medasipi. Patrick, you say what your co-host to with machine?
Okay. All right. Said Obia, happy Sabbath. This week, I've learned so many things that may use you in my own practice. And I am very excited. Say, we had the opportunity. Say, doctors, me actually what they are specializing in. Said they are kind of first Ghana, very, very, very special because in just one church, specialists be brave. We are so blessed. Now, an area, we're going to talk about terminal illness and end of life decisions. that topic, and yet topic, you know, and yet a topic that most people, because it's about death. And we all know, say, there's none of us that we all want to live. And on top of living, you know, we want to have a quality of life. But we still have to deal with the fact that no matter what, you know, our life can come to an end. A part of the life cycle. Now, life cycle, you know, just like to say like ubaya preparation, so ube wakala, ubaya preparation, say akolano, ba ube sisi, ufie, ubaya nyamebia, just to prepare for the baby. It's in the same way, you know, we have to also prepare for the end of our life. There are certain decisions I say you're taking, certain decisions I say you're making to make sure, say, end of life, you know, at least for family, you know, maybe be organized amount. So they encourage mansu training, very, very important. And see, let's get into the lecture. Yeah. So terminal illness. What is terminal illness? The doctor know, or mausa diagnosis. What does it mean? Terminal illness. What it means, and it say, we are no, at a certain stage. This is the last final stage of illness. And it's a diagnosis, you know, because it means that your time is limited. And I say, I can't end of life, you know, end of life decisions. What does that mean? You know, it's self-explanatory. End of life meaning say, the end of life decisions meaning said there are certain decisions that I said will make it. Said in the beginning, you know, you have to put things in order. Now, one thing they said when it comes to death, and as I said, when it comes to a war, we don't know when we will die, and we don't know how. And see, you know, normally somebody young like me, maybe I would think, say, oh, at the end of the day, I mean, I'm still young, but anything can happen. You know, ubetimi anya car accidents, ubetimi anya whatever maybe ubetimi anya yare. Now take your life early. And see, because of that thing, I said, oh yeah, preparations. And I know, say, culturally, you know, so obey preparations, especially at an age of before even 50, you know, and yeah, BBA, oh, obey, but so one, yeah, you can really cause some problems for not only you, but for also your family. So we'll talk more about it. Terminal illness. And see, yeah, terminal illness. So the cancer there. Anytime cancer, we all know say that is an example of terminal illness. And a dementia. Dementia, so yeah, one of those area because wadrin affected wadrin, the way I would think it, the way I would I mean, to the point of a bet to me, I also said your ability to
Can you?
yes, see my slides, you know, and change it.
Yeah, we could always see your email, so you have to share like that. Yeah.
All right, yeah, then call back.
Yeah, start sharing and select the specific screen that you want us to see.
Okay, Pajamebo. When you have my computer and Mr. Ramon. Wait. Slide sharing. Wait. Wait, it's at the end.
The first one.
Oh, yeah. Okay. Okay, just set my comment sheet.
Yeah.
Okay. All right. I think that my correct a screen.
Yes.
Okay. Okay. So sorry. Okay, so what I was saying is that dementia, the type of terminal illness, terminal illness, you know, dementia, because it affects the way we think, memory, you know, we will forget so many important things. Ebetimi abasa umano kra unkai omo. Ebetimi abasa ukru anase uyire no unkai ni din anase nenim no kra unrecognize it. A very bad illness na nirie no so no enye good. It's a terminal illness. And a stroke, coma, AIDS, all these things are considered terminal illness. And a palliative care. So you can't palliative care. What does it mean? And then you best sometimes I drew end of life, Sometimes our doctors and nurses, on be use. And a very important say you best what those terms mean. And the palliative care, what it means, say as a type of care, doctors to help treat your symptoms. And see, sometimes a yare bi wa symptoms to say pain, and I say be obetimi anya nausea, like to say like certain those type of symptoms, palliative care no go on say on be treat those symptoms, on be yama why a little bit comfortable. Now, palliative care doesn't necessarily mean say palliative care it can be just to even prevent certain symptoms. For example, breast cancer. So being breast cancer, and yet right away on say sometimes or even right now treatments are almost and the type of cancer, the type of breast cancer, and as a stage cancer and also it's it plays a big role. And to say one year some type of diagnosis of breast cancer, maybe stage 1 cancer and spread it, you can still receive palliative care. And your mama will start palliative care now. It doesn't mean say it's just meaning say some medications and treatments are said go through the actual treatments. And now I improve quality of life. Hospice. Hospice, I know say you be brave at this time no hospice. But hospice, and yet physical location, and that say, and yet a type of a hospital but what it really is, is a philosophy of care, the type of approach, and as a type of care, doctors, nurses, in this situation, and to set palliative care for this one, dear, this means that what you terminal stage of oyare, and doctors not try I might try all the medications, or might try all the treatments, or my friend, all the specialists, but there's nothing about me asane there's nothing about me assistant or stage that at that point what you hospice level of care. Now hospice level of care you're very important because doctor no ma a referral say they will call hospice. I mean, you should know say at that point in the day time you're limited, and even the official diagnosis, and I said the official ability or criteria for doctor to give you that referral, it means that you only have 6 months to live. Maybe I know exactly 6 months, but that criteria, just a meet that criteria of you have 6 months to live, and sana or mama or sa referral for hospice care. Now hospice care, as I might to say team, most of the time, nurse, na say or lead that team, Umbema or nurse, umbema or doctor, hospice doctor, or specializing in hospice, your home doctor, and our primary care doctor, so Becca team, social worker, chaplain, your pastor, spiritual advisor, home health aides, all these other disciplines are almost so gather around you and your family to support you. Hospice, that is something offer because they know say it doesn't just affect you, but it also affects the family and your own person, all the resources to help you through your terminal illness. Now, just like I was saying, say ansana referral, you have to have a prognosis of 6 months to live, meaning say, the way I near my air coin, you only have a limited amount of time to live. And another option can be, say, what go through so many tests, so many surgeries, so many things. What breath? You don't want to do any more. Cancer, say, metastasize it all over your body and see cancer no take it over. In that case, so if you tell your doctor, say, I don't want to move forward anymore, at that point, they will give you some referral. The reason why I'm emphasizing referral on this during that time, there are certain things that we have to pay attention to. Hospice care no any free. It's not a free year or and so insurance, whether it's be Medicaid, Medicare, or even private insurance, say United Health or Mono. They will not pay for any of the services unless the doctor no bema or referral. And this is for US. I don't know how it is in Canada and other, but based on US terms, the doctor has to officially give you SAR referral for your insurance to cover you for certain things. And for example, one said, hospice, medications, pain medications, especially here, because when you are in the terminal stage of Uyaria, it can be a very painful time. And so here medications. And yet to say ibuprofen, a strong ones, morphine. And as one said, if you don't have a terminal illness, or if you have just like a regular condition, maybe baby, and I say what break your bones to be, and you need some medication for that pain. Sometimes doctors, only a little hesitant to give you the pain medication because almost addicted. That's how it is. But about hospice, they don't care. Bema or whatever pain medication, because many say last days why say suffer. They will make sure say Bema all the medications you will need, but a hokano. So one year luckier if you don't have insurance or coverage, you don't have the referral for hospice. One I will bet you and see a big burden for you and for your family. And see very important say referral, don't refuse it. And I said, don't say no. Even it can be so better me go through hospice and you can come out. It has happened, but at the same time, no, don't refuse the referral that you're being given, because no benefits, no come home. A hospital bed, nurses, that to take care of you, insurance for back cover because you are under hospice. It's very important. Obviously, there's some other things that can come home, but overall, no dear. On bed try so on bed cover BBR amount. So, who is a candidate for hospice? What are the signs and symptoms? Signs and symptoms, and it said decreased functional status. Meaning that all of a sudden, before now to me and until to me go back and forth, even though you're no home, but now to me, but they say, dear, you just don't have the energy. Sorry, and say anything. You spend most of your time in your bed. That is a sign that things are progressing. Another thing, say, be a appetite. You don't feel to eat anymore. And then one of the things that doctors know, what we look at is vitals. Your kind vitals, it means your blood pressure, your heart rate, oxygen level. When we look at those things, especially oxygen, we will see oxygen levels, cut down. Those are signs that are telling us that, you are not doing well. Terminal illness, what you start stage, especially body temperature. And see, these are little things that we look at. And see, then doctors, massa timeline say, we'll be 6 months, we'll be 3 months, 12 months, or even weeks. Sometimes almost weeks. Prognosis, you're just a rough estimate. There's no concrete way of knowing. Say, that way, nobody can tell. But based on past experience and based on people are before that's now more same condition, same area, we use that to help us determine your survival. See, for example, say like ABR, pancreatic cancer. Sometimes once we give that diagnosis, we know this is usually a 6 to 9 month situation. And then not only that, we also look at states of what is going on with you. So for example, weight. your weight, your energy level, your ability to walk and move and do certain things. And like I said, vitals, all those things. Now, my estimate said, this looks like it can be between 3 to 6 months. Now, a prognosis. It doesn't mean that 6 months now it can be said before 6 months in the bedroom now, or it can be said will be lasting longer. But that's a rough estimate. Another thing to learn about brain death. What is brain death? You can't say obi anya brain dead. What does that mean? Actually, brain dead, the legal definition is death. Well, brain no and function, and there's nothing that we can do to reverse it. It's irreversible. It's permanent. And she said, yes, it will be on your brain death. That means that well. But sometimes, the family, sometimes they get confused because they're saying, now most say, my loved one, brain dead, but me share machines, all the monitors, I see saying heart, still a BT. It can be said, machine, na Emma heart, ability to continue to beat. But in all reality, there's no blood supply, the air core brain. The brain is not functioning. It's not sending any signals to the rest of the body. Another question that some people have, and they say, why is it that okay, mo say or your brain dead, but I say how can he be brain dead, but yet I say move? What is happening is that your body, naturally, there was some type of electrical impulses control our movements. And see about brain dead and about just electrical impulses, move some of the muscles or some of the nerves. And yet actual is reflexes, and yet actual movements, and yet actual message from the brain telling Usano say move, and I say it's telling Unaino say move. That part in the dear any hobbium, that connection, any hobbium. So that is what is brain dead. And see, said, yeah, cassette obianya brain dead. It means that that's it. If they are still, they're connected to the tubes, ventilator, that is what is maybe keeping things moving, but won't function normal. There's no brain activity. Coma. Coma. What is coma? Once a brain dead, coma, no, you're different. Coma, no, dear, you're not brain dead. Brain, no, dear, it's still functioning. Oh, you are still there, but I said you are in a prolonged unconsciousness. That's why you are in a state of unconsciousness. And see, it can be, say, so you can be in the hospital bed and maybe you can hear footsteps, but you are not able to actually respond. And only coma. And a coma, you can get it from maybe a head injury, car accident, and because of that, you've gone into a coma, or sometimes they can put you into a coma to help your body heal. Stroke and a diabetes for there, you guys know that is one of the biggest concerns. So when you're diabetic coma, and sometimes infection, also coma. And see, that's the difference between coma and brain dead. Coma, your brain is still functioning. You can come out of it. Come out of it. And normally, coma shouldn't last any more than 4 to 5 weeks, 4 to 6 weeks. If it starts to last long, then your risk of developing brain deafness. See, coma, we want you to come out of it as soon as possible. But you can go into brain death. And I said, brain death is a permanent situation. There's no coming back from that. Intubation. I want us to learn some certain things because, I'm not saying that we'll be able to go through, but if your family member goes through this, you want to understand what's going on, especially so on your healthcare provider, on your nurse, on your home health aid, and you've never been exposed to these things. At least you want to have some type of understanding. The intubation, what is that? Once that this past year, COVID, intubation, ventilation, so these are things that when you are going through a terminal illness or a very serious illness, you don't even have to be in a terminal illness to be intubated. But often, this is if you are being intubated or being put on a ventilator, sometimes and yeah, good thing. But intubation, what it is, let's say, the tube, and then that enter lungs. So the picture right here, this is the tube that they will put into your mouth. Your friend ET tube, the tracheal tube. Now I enter a hand. Say they bet to me, or say they bet to me are connected to the ventilator machine. Or it's also another way for them to give medications and things of that nature. So mechanical ventilation, so the mechanical ventilation, they will connect it to the tube, the ET tube, and that way, you will be able to breathe. Machine, will push air into your lungs and allow for it to expand. What can put you into mechanical ventilation? Like, what are the indications? It be already know the hospital. Now, I say I am serious. Now, as I affected the way it can be say your breathing is too slow. It can be say it's like you're not really breathing properly, or why not, or you're not breathing, or it can be say you're breathing too fast, or that as the exchange of oxygen and carbon dioxide, it be for whatever reason that exchange, it's not happening, and see not you do what to make ventilation so that it can help you breathe. And also there's risk with ventilation, because even though it sounds like a good thing, the longer you are on that ventilator, the higher your chance that will be an infection. The higher your chance that will be some type of complication from maybe your oxygen toxicity and things like that. And see pictures, this is mechanical ventilation machine. This is the ventilator. And you see it's a connected ventilator to the tube. See, that is what's going on there. And like I said, there can be complications, infection, it be a ventilator, no cry, it be a betimia malfunction. So many things can happen with use of ventilation. And I'm saying all these things because I said how these things work. And he said, Drew said, by making certain decisions, you already know, or you have some type of idea as to how things will be. Maybe I will be our own pet, ventilator machine, own person, family, who said, that ventilator. So with that, bet me, I'm making decisions, say, a bus set, or yes, serious. And doctors, say, on person, with the ventilator, no, you don't want it. Because, no, you don't want to go through that. And see, it's something to think about. And then we have something called artificial nutrition. I know the nurses for the on because often so when you have certain conditions, certain infections, certain illnesses will require say you can't eat anything by mouth. The two and then the food will go straight into your stomach. It's a way of nourishment, but also it can also be a risk for infection. And an infection, can cause even more problems and can actually lead to your death. And see, that is something to think about. So do not resuscitate. DNR, I'm sure say DNR, what is it? What it means is do not resuscitate. What it means is for whatever reason, God forbid, they're telling you, say, what do emergency room, and they're telling you, say, yeah, I made too. Now you're hospital. They sometimes will give you some paperwork or some documentation to say, do you want to be resuscitated? Meaning, say, if something happens where we have to do CPR, do you want us to do that? That document, a legal document, if you sign that document and you say, you do not want to resuscitate, it means, they will not do CPR on you. But here's the thing that we have to pay attention to. It doesn't mean, they will not help you. It doesn't mean, they will still try to do what they can with medications and other things. But CPR, process, they will not do it. And a CPR, what it is a technique you use to help care workers. We use this technique to help when your heart stops. So heart, that's the technique that will push you on the person's chest. And then we also giving, usually in the hospital, we won't really be doing mouth to mouth, but we will have ambu bag to provide oxygen to your lungs. But that process, we will not do that if you say you do not want it. And even in that process, sometimes people can suffer rib fracture because it can be a very aggressive procedure. Yeah, press it with chest because we want to bring you back to life. A serious matter. And see, so yeah, so when you need bones already, I am fragile and see easily, I bet see me. And if you come back, that pain and even complications from fractured bones and maybe a puncture with lungs and no crown, so bet me a whole other complications. Maybe you don't want to go through that. Or pass our risk. And see that you want to say, oh dear, drew me time, oh dear, mama. Then you sign DNR. Now DNR, no, you will a whole different types. DNR A, meaning comfort care only. Just make sure you're comfortable. And then DNR B, meaning active medical care. Still, you have medications, the IV, still do certain things to help you. But yet CPR. DNI means do not intubate. Intubation tube, you don't want that. You don't want to experience and see, we won't do that. If we don't intubate, we don't do that invasive mechanical ventilation. And see, most this pink form here, I'm sure it's a form. In other states, it looks different, but it's the same. The whole point is the same. Basically, this is the form that will be signing that tells you or tells the doctors and lets everybody know that you're critical. You do not want certain things. Either say be CPR or CPR, but intubation. Or even sometimes, they have something that they call a trial of intubation. But if you get the intubation or the ventilation, and still, I said, and don't force a ventilation, no free missile. Those are detailed things that me actual a good way, your friend of most form, a form I will be completely. And anytime somebody is admitted, whether a young, whether when you knew it doesn't matter, they will give you this form. And in all honesty, like I said, we don't know how it can be an unfortunate situation. Say you are still young and you didn't really dictate what you wanted. And see, these are things that no matter what, it's something that I would encourage people to sign. And don't think, like I said, because I know a lot of people would say, hey, because anyway, that means serious. Yeah, they won't help me. No, that's not the situation. We no dictate I want help. I want aggressive help. And yeah, you don't ask for DNR. I want you to do everything. Yeah, well, a session be a ubetimi atro say munye bibia moame. And yeah, not what check it session, not what sign. Advanced Healthcare Directive. And see, this part of the lecture are very important because this is where we really make, or this is where you make your wishes known. The opposite about like all the plans that you have, this is where you make everybody aware. And it's not like you have to make announcements, because I know a lot of Ghanaians don't want to talk about this kind of thing open. But you let them know, me will legal documents, matro, everything. And healthcare directives, it's focused on healthcare, how you want your doctors and your nurses to take care of you and certain things like that. But there are other legal documents that are actually your health, but like maybe your finances, you know, things that you want to make sure say, uba way, benya way, uba way, so benya way. You want to make sure say what detail all those things because they're very important. Like I said, sometimes, you know, it would to me, you know, unnecessary confusion, eba. And I know say Ghana for there, we know about that. And see, legal documents is start there here because when you make everything known and open, nobody can argue because that legal documents also. And you can give it to your lawyer. When you don't even need a lawyer to actually draw this advanced healthcare directive. Maybe living will, you might need a lawyer. If anything, no, my friend, my sister, or your lawyer, and your bet me contribute to and clear things up on this matter. But most often, you know, lawyer to draw these documents. As long as what documents say, that is what's legal, you know, in the country of United States, there you have to follow it. And see, healthcare directive, you know, there were 3 parts. Number 1, living will. Number 2, healthcare proxy. And number 3, power of attorney. So Yanka living will. Living will, you know, basically, you know, that is the document that's giving all the instructions about your treatment. That document also will say, pet sa CPR, and that's OPE, or intubation, or pet, or OPE. That is where you will document all those things. That way, you know, doctors, you know, doctor or nurse, or exactly what they are supposed to. And see, in case a while, no, won't see me kasano, won't see me express it, all that is there, and see that will speak for you. Okay. The next one is a durable power of attorney and healthcare proxy. Power of attorney. What is power of attorney? That's also a legal document that says that what appointed this person, what appointed Uyere, what appointed brother, Obapeni, you have appointed that person, say, BBC, where you can't talk, you can't express yourself, what you point at a terminal situation. That person now obe making decisions based on your finances. And to seek a sem ne ubi bia business ubi bia wa appointed that person say onana obehwe niamana so. And they are very important. And so when him say you don't want any person to make decision for you. So we'll make it sad decision. I say we'll start it now. We'll dream who is going to make those decisions for you. That is a power of attorney. And so you can't power of attorney. That is the document that says what I sign it. Say we na obehwe bibia so. And as soon as you sign that power of attorney, you know, it goes into effect. It's not something that it takes time. It immediately goes into effect. And I have healthcare proxy. Healthcare proxy, you know, that's also the person that about or medical treatments, you know, so or no na be making all the decisions. Or no na be bibia. If doctors have questions, if nurses have questions, we are going to the healthcare proxy. We don't care, say, we don't care, say, we don't care. Pakrona trust way and the healthcare proxy. So that's who we will discuss everything, and that is who we will follow instructions from. And see, legally, you know, that is the person that we will communicate with. Sometimes in some states, you know, they allow for more than one person to be the healthcare proxy. But in my opinion, you know, I think just leave it in one person's hand because also nipa too there, it can be said on I disagree with not and also cause so confusion. We befa way so befa na aye and and say better say obe assign one person. Another thing to know, how do you choose? Okay, let's say when is the right time to choose your healthcare proxy? Well, you want to make sure that Nipacrono is at the age of 18. And you yourself, you can choose your healthcare proxy. If you're above the age of 18, you can choose your healthcare proxy. And umano sono, as a parent, automatically, when I wear ubano healthcare proxy, and you'll be an abetting ubano healthcare proxy, automatically, yeah, healthcare proxy. Here so be assigned and also be appointed. But when it comes to parents that are divorced or might separated, that is when things get tricky. And see, at that point, it can become a little chaotic. And see, a trainer, it be a member, my sister, not waka kakra. So that is when the right time you should pick it at any time. And who should you choose to be your healthcare proxy? Well, you want to make sure say Sani Pakrono or Betimi I stand for you. Or Betimi I stand for the decisions I what to her. What pick you be not obi can be not what sister Adrian not and yama na sell or no not what jai because on your strong. You want to make sure that Sani Pakrono Bemu said, this is what my husband wanted, this is what my wife wanted. And America, no dear. You want somebody that understands Brafo. And it be our best to say, hey, but you want to make sure that communications that doctors, the person understands what is going on. You don't have to have like a big medical knowledge, but you should be able to understand Brafuna or more child, because you don't want to say, be I want it, then now more canona, it be a wakoye bibia, na say, oh yeah. So you want to make sure that healthcare proxy, dear, is somebody that can stand for you, that can communicate, and also knows how to make decisions when things change. It can be say, beginning, doctors say, oh, I think that things are going well. He can't communicate, but what do you want us to do? Now I can. Within a few hours, now I'm about, hey, what should we do? You should be able to make decisions. I know, sir, and yet easy, sir, but you want to make sure that the person is able to stand and do what they need to do. Of course, on best key advice, I know that you can do, but you want to make sure that Sani Pakrono go along your lines, and they should respect your beliefs. Once that SDA for your where, especially about a year, you want to make sure that whoever is your healthcare proxy, now or the may be like you Friday, Saturday, you don't want to say and so you want to make sure that person that's standing for you, they respect your beliefs. They respect the fact that this is the things that you want. They're very important. And I talked about choosing more than one proxy. I think that my Mrs. Stark and so what if you do not have a proxy? What if one yet any preparations, one draw and so papers, so legal documents, so say when a healthcare proxy, what happens? Well, legally, there's an order of priority that we follow. If one year anything, and that's na healthcare proxy by default. And see, God forbid, say things weren't going well, and that person has to be your healthcare proxy. And yet comfortable for you. The second one will be your beneficiary. Once there is most big companies, dear, on health insurance, life insurance, employee benefits, and they give you the opportunity to put people on benefits also. Those people, if you don't have a husband, if you're not married anymore legally, or it's not considered a domestic partner, paper so dear, won't worry, but more worry, be an worry. Then if that is not there, we will follow the beneficiary, who you put as number one. That's the person that we will put. And see, it could be Ubano, that's who you put as number one. And see, on Nuna, we will go to them for advice or instructions as to what we should do. And then the list goes down. So it can go down to your parents, but so mame or anaso papa wa Ghana, or no be making decisions amount. It's very confusing. It's very important. Say, try to her say, when the BBC, I want this person to make decisions for me. And then it's really important, say, documents, better a safe place. And you know what, to be honest, you don't have to tell anybody. you can give it to your lawyer. And it's a BBC lawyer no beba. I have these documents here. These are the things that this person wanted. Why not be clear and plain? And I say, yeah, lawyer cry, doctor, give it to us, especially with primary care doctor. We will put it into your charts. And it's a BBC while you're in the hospital. These are the things that he wanted. We don't even have to ask any questions. Then we move forward. And see, this is the end of lecture. One said, we know a very important, I know say an uncomfortable topic. Not many of us like to discuss these type of things, but here. And see, see and see if there's any questions or so we will be working in this field and person will contribute to. The floor is open for that.
It has a Dr. Owusu-Frimpong. And then the share what they amaye. Now what solution now can be said, maybe how say nanka ye usista a bit chim honum. Second man a bit chim honum, na feeding kaje as in the FE for. So why are ready there?
Yes, the doctor, why are ready? Now what kind of some few points I will try. I say yes.
Pachomotemenka.
Yeah,
Hi, Bushafo, good afternoon. Priscilla, what church BBM? There's not really much additional to cover. It's just depending on questions now, bebano. But advanced directives, no. Also, advanced directives now acquire category of end of life legal documents that patients may have to complete. Yeah, well, living will, like as you mentioned earlier, now living will no, you're different from will. Living will no for healthcare. Will no dear, so we japadia usika bibia dicho business and no the obetro what will. But living will no is like specific instructions that for healthcare decisions. Now, and no dan chanya. So what living will crana. You also want to identify a healthcare proxy. Why? Because to the bia, ebianya nsem na na wotro wo living will. Won enti na living will no addresses our parts na. At least if you've identified someone who will make healthcare decisions for you when you do not have the mental capacity to make healthcare decisions eboa. Now, New York State, no, we'll call hospital is part of the registration form. And you won't feel it be I wouldn't be so concerned. Say, hey, find a kunya form, nubi. Well, some more perform now. Yeah, the Bema Health Departments for, and we can work through that angle. But as long as you're admitted to the hospital, no, it's part of paperwork now. Obe feel it. Now, not press like BB say. About having two people as your healthcare proxy. The American family say, in New York, it works as you choose one person and then you have an alternate. Into ABR, for whatever reason, no, they cannot contact the first person. They will go to the alternate person, but alternate person or no, not drink channel really doesn't come into play until say ABR first one. We can't find the first one, the first identified healthcare process. So you don't have to be too much concerned about it conflicting because the first one na nebeye juma kopne say ABR first one so ontiminye na second one no aba. Now yemfa say you wasn't able to identify a healthcare proxy for whatever reason. ABR udru hospital na say na adani wasem, so you didn't have the capacity to fill out the form and identify one. We need living will and bisa. New York State's will be a friend of Family Healthcare Decisions Act. Now, Family Healthcare Decision Act, na Priscilla ko mukakra uchremu say and no, it starts from spouse, not about children, not about parents, no siblings. So it will go in that order. Ebi wa ebi our spouse because no, yama ebia ye ma no nye decision a ono no spouse no betimi ayesa and kind of like delegate to the children. But the infant say so wo yire ma o parents no ntimi meka say no yem person ne yire anase ne ma no yeah, because there is kind of like they prioritize it says spouse, children, parents, and our sibling. And I said, well, sibling to me, I say no, me munye decision, and I say me money crew, and I say ne because on my category sanity. And you know, to avoid any confusion, either say you choose one, and I say it will default to spouse. And what I wanted to share, because some of these things, me I say, bibi intimi insida, esi bebre, won. You want to communicate with your family so they know the truth of woyare or medication. Well, once our for be crowd or what ebia ni kunu anase ne yire yare crowd onim ebia ne yire koye procedure one kan train ku or ye procedure we ya na obetna efie din. And sembi ba na doctor for na EMS busa say na wo yire na wo kunu edro be na ya wo take anase why surgery pain anase or like I'm not even sure. I want to communicate because doctors for no. So I'm gonna be dance the way they think, no, they think in a way so omu rulu nyama out. Okay, oni ya rewe enti ebia de cost no ebia ye bibi say. Okay, one take it draw enti ebia ye bibi say. Enti omu ni mu no cry. It's hard for them to come up with how to treat you and the right diagnosis. Okay, next thing, you want to make sure that person like BB say, okay, you want to make sure nipa krono te brofo. And your brofo, you want to make sure the person understands. Na in saying Massachusetts, young guy be oni ebushen biya na fufo na say or back from how oni omumuvu na ase he became brain dead. Then na fufo no shia no chese. Ni roommates no na me say no mo dey na ye healthcare proxy, but ni roommates you so double. Well, anti doctor for fry nya agwa guy you so ewu omu see no say no mbesi see aya no. Omu friend neighbor no ni roommate nso a na fofo no busa say na doctor for no can say na yemfa ho plan de be ya. Ono so a brofo no ote brofo but on ti the doctor for no can. Well, so we want to go more than an extra step. So, okay, nipa chrono prof. We want to make sure say nipa chrono has an
intelligence.
You know, a certain level of understanding. Say that beya obetimi any doctor for na din komo. And I say at least the person has enough critical thinking capacity to know. So you know what? Main fresh software, na abia software betimi connecting me to abia Dr. B and I say someone or take clinical nye maybe I say. Okay, it's no me de no besi ho. The next thing is about, I think Priscilla, you mentioned something about children and custody. Yeah. Custody, there's our physical custody. Say ebia aware for mumutete ne sa no na abase ese court ye decision about custody. The okuta legal custody no ne betimi a make decisions on healthcare. The okuta physical custody de bione and krano netin today nyema sano de physical custody person will take care of that, but any major decisions will go to the our legal custody. It's our joint custody and teacher say na you would have to come to that decision. The last point I'm a person me de man say on say ye mudo do na wo ye nyina wa kwenso mu per se, right? Na to de bia de eda wo paper so say oya wo spouse no enya wo yire pa, right? And you know say no ye intimi interest nipa. So it's very important to say wo bank documents, wo housing documents ni nyeme bi wo ho a wo share that tro nipa kro no din shame say I want this person to be my beneficiary, because Chrome Hano is not so much, and yes, a chinchina and nipa say your spouse and son of your beneficiary won't. You can even have a quote unquote a close friend even make decisions for you. They hear and say obetro the shame. because mahu be paying. Life insurance kabasano obi tinchen baby ebeya wo wanwa. Well, so we have to be very intentional and mindful about your transactions. Say ye jemu sakwa. No. A drew critical point dear enye wa dream class or beba forward. No. Beba forward. Intimate man no besi ha. Thank you.
Dr. Ziada said very good contribution.
It was a power contribution of the Amaye. My addition I had the power. Yeah, to say a budget questions in their contribution. As soon as probably baron if we film. You share the chassis, I have because what the and found, but like additional corner. Idea is see. Now, any age more critical care settings, no. In your instance, will be young who dear or make decision. I'll give 2 typical example. Back a year or Yarena EMS for and buy intubated in the buy ICU. Now we have very critical part. I was say you make a decision. And now EMS since on Pekino a free Nikun Honor. No buy it and now in your contact near friend. No make a decision. And man said and pat Nikun. Don't know he said in your Nikun or my water pen, but or jai and catemuno or divorce. Now, sometimes we do divorce, but that's not as long as I can say. And now, about a question, we win in I could buy. No make decisions, I'm out of and one of my monsieur afraid say, this is now I'm making on pay. Now, on the mamma, it's my friend say, it's only a make decision, I'm man about it. Then I go to way in India, yeah, wasting negate, waste over because you couldn't first, then Mammy Abba. Suppose only cruise with the other mammy, they also make a decision. But the very controversial. They also say, or said, Mamma, it's me provided divorce papers. It just shows I'm back on any new kun. And that was say, we also in the kun, also not establish married papers. I just said, before it's me, I for back on a dear, after back dear. We win now a delay care. It ain't no a better say. Yeah, share you munano. A chromian yaban, or say timid a man shares a day. Air Juma, spare that we don't know. Maybe I'm not busy accuracy. Now, can also be it's me and young in the last example, Medema, and so a year, mine back one or no different states, and I will share Ubi New York here upstate, and I or Neno a better now almost about but not Umunya and Array. Now our 65 roots near a advanced stage, yet in a bar hospital, and now all trained for lung transplant. It's not what not lung to be MI and the condition editoriality. Now, but now business far whisker. Do man now better than China or buy and to say a no. It's indirect, obey because mine in Catabia say a friend say, oh, healthcare prosy apart from the order they buy. While about say, DNR. Well, to say mine, no, I am ready. Or no, he's incapable of making decisions on himself, on himself. But meanwhile, it was a decision now or banning the kino. So, who now to say, can you know go up? But so far as ya or bano, a friend say, legally, what a year decision maker. We go by it, and I hear DNA, anti friends say, would free me. And you know, a better say. Ye be say unako hospital is part of admission process. Ye busao say healthcare proxy only be say your forms and amount. What person sign? We do be sure no. Was yes or no. Most of the times, all Africans say hospital now. Omaka say no. The omunina say no. And I mean, I don't see the reason. I say say me sign PBI. Much they say. Yeah, adopter for no umbekume. Yes, Alex. Yes, the GP panel, see the beya, Bibi, I don't be yesterday, Yadefa. Now, I was not, it's me, Abwa. And I say, oh, being so, because in the Pipi Panabra, Infanto files. See, the beginning, you don't be pirate, what's your friend, you make decision, a mount. And you can be a then I have been said, Yenya, you can be a had very pirates, DNI, any DNR, no one can say. You can be a Yana who be Yaria, now Crana, Okra, now Abu to Pai. You beat me Yare, my Yaren Timino. I'm a Sebi or Dafaco, I'm my Ukronina, Timianachi. What do we say the pay or bread? I was okay, a jar made a manico. But now a bushiafono, a friend say, it's a debby. It's in the case of who you mean now. Say, yet Yassese Sebio in quotes. A woman at the papa dear, being as a word, papa. But a dribble be any pa air bra. It's like yes, as a Christopher for God to make a decision. Say, be or back class or back class. It's no, you can be a mayor and Kim Bush for to stand some watching united me to crow now. Only Paraquada or Rabo. If you're winning or see a family addition, let's me aboye. It's Mrs. Manubesia, Nafide, Yama, amount for also contributions and no questions, so no Abba.
Hello?
Pacho also.
Yo, Auntie Magini, Medasi. Busa, Dr. Priscilla say Obi Kuma estopua. How long no ya brain dead? Thank you.
That's actually a very good question. I mean, should that mean like the actual time period? But what I know, they say, well, hard to know, if it doesn't beat anymore, blood circulation also is compared. And see, at that point, the brain wants to receive blood supply, that air here to function. And see, within minutes, at that point, brain dead. And see, and check, it's not something that takes that long, because once the heart stops, there's no circulation, there's no blood flow to the brain. And once that blood supply, cut off, then what develop brain dead, or now say, go towards brain dead. And from there, at that point, you're considered dead.
Okay. In fact, contribution a crime has say. I speak a critical care side, they say.
Okay, go to your critical specialist and see who contribute to.
I think I can be say, Oma, Yana, Omo, a good, or my heart and stopping, even Pama, a year CPR, no, Emma Omunya, or more pause back. Most times, Oma, a check, fancy me a young CPR for more than 30 minutes, now even got 20 minutes in the aircon. Most of the time, even though say it's me being pause back, but most of them end up being brain dead. It's even with all my young CPR, in your own pause back, survival rate, survival can say pause back as quickly as possible, but between like a friend say 1 minute to 20 minutes, all my survival rate here, was but say a cheaper is not in your pause now, and most people when your pause, but I remember that one, my be a claim to try the cast can on your aneurysmic brain injury. Said it's here, I don't know.
Thank you. And me call admission, me brain dead. No, not brain dead. I'm sorry. me heart stop. And stop and almost try resuscitation. 5 minutes almost try. It didn't work. And a bra. Me dawa almost be pronounced me dead. And at 2 minutes, Sabbath toss 1 year 7 minutes. Me dawa na teamani. Me teamani no na been with 2 people almost share monitor no na ba kun sujina and manafo. And omani ma basa and I'm see a day. With me kasai. Me see a day. Me say heart ya stop. 7 minutes in ye. And wa nyani awo kasan. Intimi and I'm see to God be the glory. And until Menso, near not just me, we were.
Yeah, I think so the car say you CPR there, it means pause between the first minute to 20 minutes, no, most of them no end up say surviving. But a chepa baby after 20 minutes, I said they pause, no. And most of them a be could track us kind of when a brain injury. I think say just CPR of 5 minutes, no pronounce dead, no. Well, maybe it could be say because of probabilities. Yes, because most times more than 5 minutes there. But for because of multiple conditions, which I don't know, maybe a mile or more. Yes, yeah.
Okay, that's it.
Frankly,
Yes.
Emmanuel, yes. Marco, can I come in?
But what's my bad mommy?
Okay. Me so my experience, I see you know, say. At least we do it for about 10 to 15 minutes. Now, after 15 minutes, then we stop. Now, me another contribution be and so if far as at my experience at ICU, me experience be Ghana ni bi bewi na nipa kro ne bae no na okrobi krata enunti na yire nipa kro no say na ba hospital na no force no ba hospital honum odu honum no and was one pene me mfa edi na dan so nto na so da enunti ye de Mr. Unknown that also why the reason is say ye de ne kunu di nto na so a mine no e wo brain dead. So who are nuclear now? Which means a nuclear no any character be or the more cruma. And unti yeah, mammy for so ya say me any family member. Nanka obi de be up banning the dinner because unknown ye no question morga and one so you know. Not say befana question no befana any be. But Nadam for boy be catch them say no for be cruma. And he's a friend of an buy or buy and was on the one my panic or buy. He wasn't willing because born in Krata, who fee say a hospital a bill singing the beginning so into when you should be sent baby. So what happened is say a panic one or so or you Ghana. So the young is a kwaje, the wife no marry a man wife no for wedding marriage certificate by. I think I have them all with me now because you know, who they could see a man who was for abuse. And then in my pictures, no, then your pictures. Some nobleman, Emma, into your ding tone so. Yeah, they got to a mug. No, cry pine of furniture. I saw Uncle Yanka, you know, got to funeral home, Naka in a year. Said you see a man, actually be a fossil ya who other say where your government if you and I be bisa. And unti say I ban a didn't perform crata do man. As I say, making sure say, you found Dean and the hospital because all the Paconi hospital, who any Pacrona benefit biano, the Pacrono, in the bit to me. But besides that, the Pacrona or Tiasiano, on to be near you because who and until ye and I also saw the cratem will be a Juma. Be very cautious about that. Be beer to me see.
Yo, ma'am, it was a very big contribution by the Hunya and Maya in their contribution. I mean, so our contribution out there, Maya. Now, Obi Bisa at what age? I think that Franklin Nebisa said, what age now? What's our year healthcare policy? Now, a living will, no, and that lawyer Owusu-Frimpong so as on a camera or see at age 18 and over. It's me. Now, who said Dr. Justice Owusu Ajay. Also contribution like that. Dr. William Wessel now or me too now what the contribution about.
Until they make an
Patriot.
Okay, hello everyone. Happy Sabbath.
Happy Sabbath.
Okay, this is and I'm very happy to have joined in on this conversation because this is a very, 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 very important topic. And this is something I me dealing with probably on a daily basis, where I may find out your healthcare proxy, may find out the person's wishes and their enema nipano pe, where while omu level and also close to death, because most of the time, brain death, we deal with it. And brain death, such situations they are easy because brain death, legally person near dead. And such decisions near easy, but times that we hear healthcare proxy, then it becoming very, very challenging. Doctors Kasai, they say Amoka say 18 and over, everyone needs to at least have advanced directives, and I say Omar appointed someone as a healthcare proxy. I think they are very important. And conversations are only or yere now new kunu ewo honoma also mo have no. A very tough conversation. Say obeko kunu ho akobisa and say, hey, na say bibi ya wa edien na wo pe. And I say a very hard conversation because maybe you're beside me same thing, and maybe you're a doctor or beside me same thing. I mean to me bisano the same thing because me say oh yes say obi eba hospital na say BB in the brain very, very bad. Maybe a doctor na me who say nipa na me ka say I don't think say nipa will obey live, and also live ne honam beye tantan and I want me no kase bio want me move bio want me nye ma nipa but oka sanse nature healthcare proxy na omu ntiase omu adwemu de omu pa ne se omu pese nipa ni live sometimes and no yet the best thing intina and what's all have us our conversation say na be ya o partner no be hu niema wo pe say uye nipa bi a person go nursing home for the rest of your life e bi enye ade a wo pe and access an niema na your time nti a very important conversations also obia ne partner have and I think so also all have it in writing if possible and niema wo pe because you can't a brain dead and I say death, but maybe what we are say worse than death. So often when you stroke affecting the language and in the honam a efa untimi move bibia untimi ni obi ankasa untimi ntie de obi aka no. And I think so down pass all day and night. Ultimate controlling the body functions, ultimate controlling the bladder, the bowels. On say obien ho we are say obe join ho say sad and or pay for itself. And I think so if you on crowd we get it to a point where we team breathing, we hear trach, and I say feeding tube, send a be more nutrition. In Tisani meaning you know say ono partner etnase na mo kasa say it me drew point ben na obekache doctors ne say enipa no person obe live this way into also and you letting it go no ni nyame nkotena ho and I say me e be on my share patients me catch o say a nipa will better nursing home for the rest of your life. And also untimi move and sa untimi kasa. I've had some family members catch them and say, "Sana no ope," or no the open say, "Oh leave." So no matter what cost, make him save his life and make him live. And no easy, but tough ones in here. In nipa osha on person believe but family no a person omu many level living in your good living into everyone I think so also be have us our conversations. One more thing I wanted to add brain death how long now or hard to stop or brain started injured most of the studies initially we said about 20-25 minutes. Say restore it a blood flow to brain start here injure brain. But you can't all the time say time is brain. There's no need to waste. So it'll be a hard to stop. And I said BBC. I would say at all costs bring them back. And in terms of CPR, no, it go on my year for 30 minutes before I'll best stop. Until men say, oh, 5 minutes, 10 minutes, yeah, a good enough time. No, it go on my 30-45 minutes before Rebecca say, okay, I tried BBR, Nenipa na my back. That's what I wanted to add. Thank you.
Yeah, the doctor was a the contribution you can career, because my witness be preparing. No, a young guy, 28 years. A year CPR, it took us about 30 minutes and over 35 minutes before I say here again and the pause. Now we all thought say brain dead, but I think maybe because he was young within TDR, he ended up living. It says that Dr. Ekano, time when he applied, but we no exceptions there. And so 5 minutes is shut for them to stop the CPR on you. But we don't know the reason why we are not on where side in the intimate.
If I question, but your answer about this our question, Mame Adibibi. One said the younger you are and the more healthier you are, let's say we are healthy, we need high blood pressure, we need diabetes. As you say, CPR is more likely so best survival compared to so many different health complications because already our body is already under pressure. And so we are healthier, it's very likely so me I come out of it with very minimal residual deficits. And see, that's another reason why I say you're maintaining our health. And I say you do a certain point in I think that share your health, because the healthier you are, if you go into a serious situation to say needing this type of intervention, likely say, or it's more of a potential say me every month.
Yeah, that's a problem. Say,
If I tell me about my question, Emra. If I tell my question is, now brain dead, now maybe say, my year 2 surgery, back when my breast, back when fibroid. Now that 2 surgery, no. Back when you nipa, I'm a year me first. But when you are sorry, and I'm sorry, second one, so the same thing. But I thought that you mean you're free, but now me home. We no one say. Now, one I mean to me, sorry. But your mommy did and say, some of my and another doctor's best assistant, now me doctor no, or then it's a fat home. As or it's a minute ya penna. 1 year, one back what can say, Munkam, one among for ice and memra. It's not in this case, I mean, that be saying, not me a chance to brain dead,
Debbie, in your situation, no dear, then yet brain dead as them. The effects of the anesthesia. Anesthesia, no, I said it didn't come out of your system yet. Also, your kidney function, so you're different. It could be say it just took some time for anesthesia or for you to come out of the influence of the anesthesia, but you wasn't you wasn't close to brain dead, and there was no concern for coma. I think it was just the effects of anesthesia.
Okay. Thank you.
So, a question about me, Abaso.
Topic away now.
Question.
Yeah, topic we want some care then. Open your memoir, Basso. But yeah, open minutes, memoir, Basso. And what's more caring by idea also come home as to be a kind of who the papa dear. But missing now ye can ye, my comedy action, my wife the dada, say me stage view drew out, say this is my comedy action. And yes, as couple, into the family health retreat, better say, share these information. What's our interest will do?
Right.
But yeah, I'll say to me in your open discussion about these issues. Boy, opinionist, what with Macasa?
Opinion does doctors, so I'm also the moon answer. And Mr. On her Utia now here. Dr. Priscilla, Dr. Gas is near her, related to younger people. And I'm more exposed to there's nothing like a touchy subject for you. But I am California Panim, you know, a little tough. And practically, advice Ben out of my to open a conversation in the family about this topic. How should we proceed? Because to tell you the truth, my dear, what is that family? Now, I come stop on a practical, you know, how should we proceed to talk about this touchy subject in a context of Ghanaian family? Because when we say death is not something that is welcome.
Right.
And idea when so you're linking so much to death, but perhaps ABI it has nothing to do with death. How can we present it in a way you're very comfortable to talk about it in the family? And what is the best time for a husband or for a wife to bring this subject up in the family?
Your opinion, Pachopakasa, opinion, Sipa.
Oh, me ba so late kakra. I think say wo Ghanaian community no. Ade ba ko a ye nya ho ade say ye mudu do say and ye wo attorney, ye wo lawyers. I think say it's about time. So ye feel no kwa animo no. As I say obia enya legal practitioner. They said ye wo doctor alcohol. War dentist, alcohol, war ophthalmology, alcohol. As I say, it's about time, say, you know, so you best start your dream, who say, as so be a legal practitioner. Because a hot will be to me a free bar. Because as will be a living well. And this a living well, so almost and a burial. Intended by say family, no, it mean family practitioner, it's a legal practitioner. A home the be open our communication when you na even though hospital you be so, but Obia one more hospital you as a power of attorney. Oba is a home mempe. Obia me hospital see any say who could procedure who advanced derivative in this animal or brushing off because maybe I would don't crowd and no crowd no defeated that purpose. There will be a milk baby after more advanced derivative. But you're starting with your legal practitioner. Obeti me, I prepare family no. Now what should I living well? No son this I know the best time. And yes, I know could do hospital. Na say you advanced derivative, but brushing off because so beti is as no. You can cram some the one.
Your opinion was.
And my main answer opinion is question. On said this type of discussion. I said while we are open to the conversation, to the topic. I said while we prepare what and say, okay, we are open to this conversation because the way I and say, hey, and I said we'll bring it this type of conversation, person who come in think type of thinking, and yet you will not have that conversation. You will not be able to have that type of discussion with your loved one. And see, and here I said we are open and change your way of thinking. When you say you say you cool and I say you pay BB everyone see. I eliminate too. No. And obviously, you know, you're there. It's all trusting. It's all who say that is not their intention. Oh, it's a way of thinking of this topic. You know, say SSR. Now we are open to the idea. Say, true, Mano, you don't want to leave. Now, Mano, want making any plans for them. Oh, you want to make sure, say, at least, and there may be there, you have organized and put it aside to say. The opening a child's most of a kind. You want to, if you have a lawyer that you can give those documents to, maybe you don't want to discuss it with the family as a whole. I know I can understand because The same way, I'm not going to go to my 10-year-old say, "What? These are the things that I want." That is not a conversation that I said or getting involved. But say you have a lawyer, that is a good idea. And I said, well, doctor, no cry, because at Drew start point, the doctor will be made aware, say, this is going on. While doctor no be documents, you know, and say these are the things that my patient, that this is what he wanted. And see, either say your family or someone that you trust, you have to have that conversation. But ultimately, you know, you have to have an open mind. You have to be ready to have that. You can't close your mind and have that thinking, say, oh, because this type of discussion, I'm even bringing death upon myself. And yes, sir, you're just preparing and making things set their family, you know, they won't have to suffer so much.
Okay, that was it. Most of the say, Minyo co-host into me, Huni Papa Pianas. Okay, Nipan Sato. Well, and Doctor was in power for Emma, so I'm questioning. Fancy be make it healthcare problem, may make it prosy, healthcare prosy. Some more casting 10 minutes matching the power for Ashagonum.
That's a very good question. What they recommend is that at least every 10 years, so what picky healthcare proxy, with the legal documents, not so far, let's say, what do age 40? What make you decision say, well, you're in a healthcare proxy. But let's say, for some, whatever reason, or maybe a weird crowd or more separated. It's at that point, you know, we'll come back to documents, you know, that will make it changes. They recommend either every 10 years or any life event changes. So maybe for and I say, you know, even adding children as beneficiary, new baby in the family, not what's our back, not what make it addendums. So any life event change or, you know, routinely, you know, or while a number of years have gone, and you will go back at that time and then make some changes. And so, yes, you can make a change. It doesn't have to, it's not said as because you put it there, it's permanent. You can always go back and make changes. That's and the same thing for DNR, do not resuscitate, you know. So, you know, maybe you had an idea, say, but maybe you've been educated and you have some more information, and I said, oh, diagnosis, and I said prognosis, and I said, so you want to change that DNR, you can do that at any time.
No, that's a part. Say, Obi Horma Obusu to me the question about now contribution.
You, Mr. Danso, maybe some question, Kakra.
What's your part opening?
Yeah, my question is, the Amoka can you very good. Now, Momuno. Boa me the margin me say more amosi su sabre ya mo wari moni mo yire no mo bobre na fa sabre questions we no ebe boa na ya na e di kra wari na ya kan kra ya kan e bi kra wo yire na ukun ni ha wo no wo Ghana wa ha na sabre wa kwa sinsan kra te ya boa hwan na ya sa ne ma we no so ya amfa ntete ye mfiri ya hyase enti wo koke kan we no mu kra kire wo yire na je so pesa okoja no ana so pesa okọ ntem na uja no it no in fact some say no ya na ne kanu ya na edi ma yen as a Ghana you know community ni nya de ya de bo etete yen it no questions we no there me feel say good mum good see aka kira you last near ye family kura obi ka say we kura no koya ahwa o yi no be kuntem and as a kunu zo be kuntem tino say enya de ye used to this. Oh, Tino, what Emma, Emranti, and Mabawa be a marshas, you know. Tino, sir, questions that is say, no, I will be a Uku and I didn't have now a single parent to be now. Ha. Somehow you came, Wabempa, and I will be a free. And I feel yes, assume you know, Penny, Doctor said to Sukan said. So, and anyway, but a question and how much in a so say. Who pays you, ma, you know, and cover no kakra. No, not just a pesia. We are who face you who no more, not one who running in that tower, no, sir, not say. No, man, tears ye, and some we know, yeah, Monchere as ye kakra, me that's it.
Ima kame pese me answer The first part, no.
Very good. Come here, from. So that's good.
Penny, was a situation, mu say be a or money or moya now mukrumu woman chum single parents. Krana. These are really made for them.
Right.
Young people know dear to say must say was so in the ready home commodada. Won't. Young married couples are more current as to these type of conversation. Any crew cry and ya worry for cry legally. Ya maybe what is see any mood that. One, but yeah, and penny for no to say wow my contribution. It's really, really for you because if you don't have an healthcare proxy decision, no baba that sorry no so over here yeah fret pastor, yeah fret penny or less. Not what not at this one, but now it's a concern for the church because we do not know what decisions to make. One day I may patch and you know that group of people crying here because there's a lot of ambiguity, like just say you're unclear as to how do we move forward. It's a difficult conversation. Tina, Omayene say you can even indicate with close friend.
Yeah.
And Tisano or close friend be our trusting no, and also him say Dr. Fra or no was our reasoning capability or strategy capability say obehu or more I saw frefra or monamufa na mwetimi afa home plan. On say be more or monisa thinking skills so I send we are by yenfa who I dream any say. One obia one a talent will we say one to who are down phobia sha. Or what say you know betimini ebusia for din komo or betimini or software ne aswen penny for ne din komo afa ho adwen say no openi braway situation dia ye yanye ne say those are the type of people you want to indicate.
Yes.
Hospital trauma din say openi se su na obetro ni din o say pastor sa akode na obetro so openi po na wa trauma din na che say I fine e more so I want to emphasize I said the church e more so for omo they don't have the family structure.
Right.
Oh, here pa esa obey liability amount now for 4 ne asafoma na ye hu de yenye adeno. Okay. And thank you.
Lawyer there was a pa ye pa nyami shira. No can one example now I'm crying for next question. We better hospitals no.
But that's what say toothpaste na ye January
yes, yeah, Efro. Only can we academic lawyer kind of saying incident be tisasa. A basana is him so winning will be chrome here. It means that no family. Then a basa, the hospital will be taking the decisions for you. If you don't go on penasa, 18 who here say even class of within here, who should be here, will be our bear once or down for what trust on, but me papro aye, beat me up lawyer Owusu-Frimpong there was CP. And he made Dr. Justice Justice or say 2000 with the Abba.
Also, they know can you say a toothpaste no I January maybe as to choose you here. Na ye kase and friends you who were nimu. And you Ghana for I chroma for grants to beside the same thing. Say, oh, catch oh, it's wow, this is a new information I never heard of. So, baby, I'm not toothpaste because some toothpaste, no, they already it tells you say do not rinse because toothpaste na you draw. So, young fan says, be a cura too. Now, dear draw to so. Never now, no outside in your head. I hope free so. And yeah, Juma toothpaste ye drew. And you know, what take a crab, you say, and ye be brew. A crabby or the bed to so I will to sink a crack a cry you and you may also sing in a free mono. No what tea a huronabu, and Cassafa huroning in a goo and no more tinning in a goo. What tiguma residue in a crana cow or noon. Fluoride will toothpaste ma a boa mouse as a fem as a protector was sent from caca. So it's in a boa in a long way during the day. Now koda the same thing. So it's in a draw, nedro so the other goo. A BM say a crew anymore, and I say, what do you goose here? And what I am faddying in Sunya day, and who. And on this our concept, no. And so we answer interested be a bit changing the taste of your food. Don't because Yankupon naturally, no. I did be a yes, sir, to say, drone, a woman, not naturally, no saliva. So, night dilute to say in day. Amount. It works. Me and try.
Person added BB to that question. So what you can do is if you feel uncomfortable, and then you're just going. Another thing that you can do is say, if you have an area in your mouth, ABI is very sensitive. And every time ABI then it's very sensitive and it feels uncomfortable, you could just put the toothpaste on your finger, a very small amount, and just rub it on that specific tooth and go. And it's just a small amount. You put it on the area that's bothering you, and then it can help with the sensitivity. And another thing is when you're brushing your teeth, you just use a pea size is what we call it. So the vegetable, that's a pea. The peas, you use that small amount on your toothbrush to brush your teeth. So honestly, I know some people, brushing your teeth now, you pass all this grow and all this come, but it's not necessary because it's not about the toothpaste. It's more so of your action of the brushing that's removing the bacteria. So you just need a little bit of toothpaste and then you focus how you're brushing your teeth because it's not about the toothpaste. It's more about how you're brushing your teeth. And if you have an area that's sensitive, you just put a small amount on your finger and you rub it on that tooth and it should be able to, have that same effect as opposed to not rinsing out after you brush your teeth. I had a question too. I don't know if I'm cutting somebody in the line. But my question is, if you were on your deathbed and you never had the chance to maybe change your health proxy, maybe that person has passed away, or maybe you decided that you don't want that person to be your health proxy anymore, and now you're basically dying, but you're able to speak up, can you change the health proxy, or they want it to be a legal document that they will go by?
So as long as over Timia Kasano or express yourself, you can make whatever change at any time. Because it's you that made that legal document and you are able to express that I want to make changes. So like I said, it doesn't matter, there's no time limits. Whenever you want to make a change, you can change. Over to me, a living will, no, and I say you over to me appointed healthcare proxy, today, no, you can do that. Or even within minutes, you can say, I don't want it, I'm changing my mind. So no matter what, as long as you can verbalize or express that you don't want something, they will change it. The point of these documents, is that the whole point of it is because if you're in a situation where you yourself cannot talk and say, these are the things I want, we want to make sure that your wishes are still made, your wishes are met. And so in doing that, you will put a document aside to show us that because you can talk, you've appointed this person, and as what dictates certain things that you want to happen. So it's a way to just protect you, because if, God forbid, you're in a situation where you can't talk, you've already put things down to allow for whatever your wishes are to be followed through. But in the opposite way, let's say that you're on your deathbed, there's no way that Ubetimia communicating. And what try to her say you want so and so to be your healthcare proxy. That's the person that's going to be the healthcare proxy. Maybe you don't want that person anymore for whatever reason. Unfortunately, that person will still be your healthcare proxy.
Yeah, Doctor, it was. Obi asking me.
Sorry?
Maybe it's a question. Maybe send me a question. I say it could happen. She said when the healthcare proxy no critical care condition bi na munina mo coma state ya e basa na dey never happen. For example, ebia obi ni ene yere munina nya lorry accident wa ko hospital munina in coma state we healthcare police healthcare proxy basa na dey no ebisi question.
Said American or Dr. Zobekasa.
And on that earlier, na me say New York State, why say Healthcare Decisions Act. And no about that act will go into effect. Now act no say your spouse is unable to make decisions, not about umasu. Umasu ni wa not about parent. Parent ni wa not about sibling. Hospital no follow sa next of kin enti. A drew or sibling, not just a bushafo no be any na about closest friend. One, and now next of kin. So the bet me ye who be I just say be our cousin be a che one. And no or follow side, we shall follow lie, or you be maybe our back closest friend, and as an about next of kin. Thank you.
Make me a question.
Okay, but what with me question?
Okay, your fan said, "My name is Rohai." Na I'm a American bank when him say me no. Na me na ya ejapade ofi. Na me kofi na akwaye wo. Amfani na hyeso bi. Na ma ya ma e kan se me busuafo. Nti me no betumi afrasi akogana akoclaim say wani me na ejapade no.
The thing is, I'm not too familiar with Ghana and Mrano, but Chrome Hardy say, Yemfani say, Uye Japadie na wanye will krana. No matter what, no your wife has to get 55% of her property. They have to get it. And you're even cry 55% to cry a bemu at a time where waka say abia won't percent what way free her now will I trust abia won't ma wo yire and asa ukunu bibia aban beka say no ukunu and asa wo yire no they have to get 55% of enyemano. They don't even consider the children. But say Chroma would throw away what they call Ghana, it stays in effect. As long as I would throw away or no come out, will sign in or witness what they call Ghana, it is in effect. And I'm assuming, say, it should be something like that in Ghana, say, by now in 2021, they consider the legal wife first, as opposed to a busuafo. I think, say, a baby bisa or Ghana. Well, and Tinebi Crown won't throw will be an answer bibisa, maybe a japadie bibemwa. Or move consider the legal wife. And Tinoane says a marriage certificate or how if it becomes even an issue, would the marriage certificates no qua and no should be enough.
Doctors to contribute on that.
That was it.
Me pacho, Mame added something to doctor. In Ghana, so now without the certificate, he dies interstate. The state comes in, no achemumi and son. 1/3 is given to the wife, another 1/3 to the children, and 1/3 to the family. But say, a marriage certificate, the ma or banning now.
Open name Epacho, I think say Sisiano, Ghana Mrano, almost Samukakra. I don't know, you find it out, say Bermano, Ewa Yirea. The state comes in, ebeji ejapadiano there was so bad in yani biano or the amano, even though say 1 year wella, that is how Tisiano mo ayeno. And that's it.
That's part of my okay, upon any pushing the map.
I got every question of Busa, no Busa said, Sendipana ya Japadiano fee, no their map, and the bush or their babushia for. None the year no hand no unfanity and canwa, BBC, obetimia coclimana, no cranny ever did so bit macoclim. So I your world no, Eddie Ama will be dear, any easy ma or bano, and I said, I said, Beb or Banchina, any easy ma at that partner, and so obetimia coclim. So far as why your world, I will lawyer honor, a bayadi, and the Moma in Chirimuyina, and we now, what you dear. A secretary Kayana say on your world dear Nesse ultimate abia marriage certificate ko cheso mi kunu na mene ne tiabruchi no bra ya boni say ni say dia or stand a good chance but your world side other party na ebe ye din pa say other partner no ebetimi ensabetimi aka dia o send saka madam was
pamcho mo mama kan bibia kakra
you open
yeah Lawrence yeah mrabi na sechikan se mo da so ya warefo a no matter the obia fa akira koye wo no omra wo wu ana bibi ya na mo da so ware na mo nya ya still wo mo tin defend that recent na say hwe ni ko obi betia fa akira koye na japade nyina ma na busuafo no agya na yire a ono abre ne ma once on da so ware a
While evidence was one Milano sound go back. No matter the lawyer be become Ghana, and that's the ruling a year. Now, my question, I'm a man in Sassuan, be answered. Secrecy, I was communication wise. Yeah, can be a what they were now about to turn your muscle. Now, one country, no. I think say I know if you see a boy, a partners, and money, everything once ya, you know, not. Obi who say we na we are we so who say we na we are. Now the thing fine. I mean, the question no clear. Is it appropriate to do that, Yana? And I said this all keeping a secret out to so big.
Me pacho dan so before some be answer open question no my main clarify bibi kakra. Open on say na ka PNDC law 111 no. Eno no say nipa no ye nim say ne yiri ni. But say when it comes to will, say me will, say me yiri ejapade me money bia. The court has to respect the will na me maye. Our Ghana asem na woka no. The court has to respect the will na maye. And until obi en ho betimi a change say no mo nim say me yiri ni nti so mo de ejapade koma no. And ne ye me decision amaye emra eda so. Say bia me ba anase me wo fa asibi na me wele me nyoma nyina ade ama no. Obi en ho kwan so obesesa no. Nti me pacho ano no wo say ye clear ewo. Me da say.
Opening Edward Sequoia, contribution, the about the contributions here at the abiding. We did say opening question of Busai Ghana seminar. We say, young find home contribution in CHC. Nagopo Eboa and be a permanent. Yes, I will say a tribute, but the now opening case is can Southern men of many women be but still there is a tribute as a Ashe. Ebusa lawyer for more Ghana be a USB or Inya science Muna, Yema Asama Ati. Where the lawyer Owusu-Frimpong, Docas, our assignment here, if you may. Okay. And yet, I think the opening bizarre question be say secret or our room or say a cost secret, say sad name. Where the penny-for more some
I don't think so we'll keep on the secrets. I think that it's very important. So Becca be actually we don't know. So we're supposed to be because let's say they not to healthcare proxy. Maybe or be on one him said Sanya man on to means standing on you're comfortable with that. And say so man a chance. I can say yes, I accept that responsibility. That's number one. Number two, legal documents, you know, legal documents, you know, too. It's a baby that time, no, we don't know anything. Yeah, you know, what's everything, you know, nothing that legal documents, we don't even know. And see, in Shishaya, who planning be all those things that we're planning, we didn't know because one can't. And see, these things, you know, should not be kept quiet or secret. It has to be open. So as a woman, we don't know who said my assignment was our responsibility, and she has to accept it. Because then yeah, by force, such in China, when I will be making all this because they be on feeling comfortable to do all those things. There's a woman Sani Pakrono chance to also feel comfortable about our responsibility.
Okay, that's it. Mammy, some frame upon the question with you. Last a boy, I almost the same question, but it's framed in a different way. Because many science expensive be pain, our patients on back hospital. Within back no chronic illness, be say cancer, because in a chassis, if you are fancy because diabetes, but I do stage be a control the man. Ubu san say be our support or fear, as be our kunya years ago. You couldn't any more. So, Ubusan said the 8 years ago, the catch then Nakuma betu ever home. It's the more you come here. Advice about the my was
yeah, that's why that person on teaming yet will healthcare proxy. Because who said on teaming that position or on teaming handle and see you have to put somebody else. So choose will be able to me a handle. And see, that's how I will approach that. I will pick somebody else. Except at least you have to have somebody that is on your side that will best support you. untimi nka say omo de omo ntimi de me anam I go through way. No, you have to try. I even say what pick it pastor or even wadamfobia enya even if your wife and children are there, if you feel say we na upesa all making decisions emawa and fa say or you know you can still choose anyone. It doesn't ubetimia piki obia. It doesn't matter as long as ubenya obia ubetimia boa during that process. And I know here.
Yeah, but that's a pie. Obia some questions so about Mahase. I'm going to say if I can't make decision for myself, can my head Proxy contradict my wishes?
No.
Okay.
As long as there's a legal document and you dictated certain things, they can't do anything other than what is on that legal document. Now, what dictate, but you didn't put it in that legal document. And yeah, in that situation, healthcare proxy, bet me make you whatever decision they feel say and so when him said, and maybe you want to really make sure say amount for follower, then you want to document that. Other than that, if it's in that legal document, the healthcare proxy has to go with what is in that document.
Yeah, that was a prior. The question by chat name may summarize not say surgery a mountain sign documents be 5D and healthcare proxy income with
That's actually a really good question because sometimes surgery, if you have what apply for DNR, sometimes we can suspend that DNR because surgery. You're trying to do something that be a bit to condition. And see, sometimes when you doctor now you suspended DNR. So in that situation, that can happen. But it's always like when you're going to the hospital, you're being admitted, we always give you these documents as signing. And see, in that moment, you can assign a healthcare proxy right before surgery, say, if anything, if I can't communicate, if the surgery goes wrong and I can't speak for myself, this person is going to talk for me. And see, before surgery, you can do that.
Okay, that's it. So be a master there, the Mamisa question na boy kakra so has and new instant be happening to family be. Along Ghanaian family mom. Nipano enya end stage cancer and Dr. Sankaso on funny Emrefi. Now on the Baba Cope. That current no be 18 years or so. So the family
was say 8 and I say 18.
18 or so, 18 yeah. Nanka family per se be a hospice na be a honum. But Dr. Sankase on funny Emrefi. Martin was be a shame thing was na be few crab na as we am tell was. It's no family per bisa. Dr. Snow to me say family few.
No. Dr. Anuntimin decided for you. What our job is to make sure that they're all panel. That's what we are going to do. So you have present to say, these are your options. Opa, ubetimia call this facility, a hospice facility, and they will also offer say, opa, if you want to ubetimia coffee, not your Sunday nurse, all those other resources. Now we cannot say it's a chinchina no dear coffee or whatever facility. It's really a decision, it's a decision made by you and your family. And also maybe it can be said, there was insurance or coverage issues. It be our insurance, and for inpatient care. And see, maybe that wasn't communicated well. It be on one, they didn't understand that part. So the insurance is also a very big deal. Coverage, that plays a role because they be a pet, even home care, no crown, they be a pet. But you won't need that coverage to even provide those services for you. And see, maybe that's what happened there.
That's it. So the powerful question I'm waiting me the about that contribution.
That's
Part of with Macassa.
Minimum, I'm sorry, Dr. Thompson is an answer, maybe I'm putting up one. Last time, so.
I think so also.
Okay, Menino. A drew by being not just say, Dr. So, my glasses. Now, we are boy, and I said a boca crabby, Me who idea there, but what I say a book. And I see the doctor say, but I don't know who idea for satellite, special satellite teams are there. Me who idea for, but you know, doctor like solve my glasses. I know bit my solve problem, and I say, I know just say we have surgery.
Unfortunately, Dr. Thompson needs so. But you know, on so. But Dr. Saka was so be a person who
yeah.
I want to say or no better answers our question because I don't know or more fields, you know, I'm not too familiar with it.
Oh, okay.
Unfortunately, maybe next time, and I say you did or doctor no information or be man or not or answer man.
Yeah, upon you meaning come out today.
Okay, that's it.
Yeah, number man so at it.
Now because you back home, I'm said doctor said to the say two persevere, we bring kakra one man. Now this a persevere now who one we na the kakra be fast so and so yeah. Because you do any did so be an anoche.
Opinion na Dr. Salome Owusu eka ya no say fan say baby ya wo ya no say fem no wo no toothpaste nka kra bi no dia fa ho so ho ti sa area no ho no nko anso no utumi de toothpaste ni fa ho no wajai ama on say no nka say toothpaste na ye dro no ti wo de fa ho na ebe boa afi wo ho abut over time na se fem ni nyina ba den ebe free ho yeah
okay. Doctor, that's it. No, that's it.
With now, obviously, send the question, Bremen. That question is not a Dr. Justice also AJ. In particular, now your campaigns was seminal. No, say, I'm not to know our pain, and the pain, a banajo, a ban and sat when Timmy and Hoshe. I drop that and the pain by looking up from bed. Now, I don't know could be from the spine, as it could be from there. Now, we should question or what has the blame. Seems that if you are Dr. Also J was one of the start question.
So good question. I have a question as well. Pain no one hand for.
Me the occasion say and it will keep up from what that I never data we okay, but I drop down the pain neighbor.
Okay, then hand for.
Or you can say a right hand, right now. Okay. That's the only information I can give for now.
I think so. My name friend me and I said give me more information because also who baby a pain there a travel call hand numbness tingling associated and I said you know there's a lot of information that needs to be figured out. That's the thing.
Okay. All right. Me background. No problem.
Dan so me a question ma Dr. Owusu or Ajay.
Okay.
My question is say sometimes you go neuro orthopedics now. Almost we catch us spinal problem or spinal there's problem with it. Be our herniated or bulging or stenosis or whatever or arthritis. Then they give you a referral for physical therapy after repetitive, medications near the not just influence of them. And I said sometimes you don't want to be taking a lot of pain medication because of fear for kidney problems and other things. Now, we call physical therapy now. The very moment our physical therapy now, where we and especially a massage one only hot massage, sonogram that if you buy, you are okay. And yet, pay national. So what causes it?
Very good question. And this is something I hear a lot, and also a patient, chiropractor. So not say chiropractor, new move, I won't say pain, I get it better, but coffee, I won't say about back. The thing is, depending on the air cause of pain, if you on say joint now, me can't share more, me show more pictures, back, joint, it go on rub it together, ne cause pain, It is all physical therapy and as a chiropractor, honoma, omu put you in positions to be a joint in him, send a be as our pressure now, and as a rubbing there cause pain, a money go away. It is so coffee within 1 or 2 days, or body need go back to baby a 1 hour. Now, joint and then rub it together, be an affair cause pain. The same thing says, muscle pain. That's will be my massage, not pain. But so it causes our pain. Next day, not pain about back. Because the physical therapy, chiropractor, this animal, omu problem now way. Omu do we near maybe a timmy it decreasing pain now, and I say take pain away. But problem needs to stay there still.
Okay, now my question is so if you go and you come back and you are back to square one, what is the need for the physical therapy? Because it's a lot of money. So only insurance, you have to pay a lot of money, and insurance, sometimes you have co-payments and other things. So if you cannot take away that, sometimes as soon as you do fear now, and I said the next day it comes back. Well, so what is the need for that physical therapy? So
it needed for many reasons. One, they say back pain. No, almost all, I'll say, your studies depend on their causal back pain. No, 6 months with or without surgery. No, sanko for no omuye the same in terms of omu pain. Inti ebi onoma unya pain for bed 2 weeks, 3 weeks, but given the time I want the pain go away. But about unya and share won't say a call. Because the body need adapt now, body so it change to adapt to pain. No. The next thing they say so-called physical therapy. That's it. Called many times. Let me rephrase this. A lot of people call physical therapy now. Pain go away. Might a clinic bill. But in Nipa now call physical therapy over and over and over. But pain in your and get it better. No? That is telling you, say, it also dealing with issue near causal pain. No? Until so spinal stenosis and now arthritis or back. Now no causal pain. No, now we try be na say intake pain aware. And no na say pain is bad enough. I may recommend this surgery.
Yeah, but at what point now we need this surgery? Because surgery, sometimes doctors don't recommend for the back surgery because you're 50-50. So we bet me a survival and I said worse situation. So at what point and I say we are back surgery.
So I will tell you something else. Back surgery and you're 50-50. So yes, surgery for the right reason and for the right indication, any pathology, meaning so will be physical or back and it cause pain. And as a doctor, you free hornoma or pain, no, it should get better. It should get better. Now, the reason until I don't recommend this surgery for anyone to begin with, or spine, 10-10-10. Any movement I'm making, or spine, move it together. It is okay, yes, surgery or baby. Now, if I change the way our spine, move on. Until I am recommend this surgery right away,
Okay.
Spine move together, no, and then it lead to problems later, no. But there are so many people who spine surgery, my clinic because we are feeling good, no more live normal life. But
so the lucky ones, no. Okay, sometimes they recommend nerve block. So how good or how bad is the nerve block?
The nerve block here very good. Before I make surgery will be I recommend it first. And I would tell you, sir, there are many patients who are clinic, or who, let's say, for example, disc herniation, hit a nerve, and we can see it on the MRI. Said disc and hit a nerve, and the guy or down passo for 2 weeks. Or ba ya man steroids kakra. Now so ya catching so-called pain management and cogit shot ewanechi. Even though I'm just gonna surgery, no hiano. 1 week later, 2 weeks later, or back clinic or say, oh, I almost missed the appointment because me pain neko. Okay, it is any panel. Even though I'm just gonna so big, I hear surgery, no. Me pain neko near jano. Oh, in or my clinic hobby. Oh, before I bet thinking about surgery, and also try also try physical therapy. Ubit me, I try chiropractor. Ubit me, I try injections. Now if you want to try a massage, acupuncture, anything a bit help pain. While and so I would take a NSAIDs, over the counter pain medication. Most patients only hear surgery.
Yeah, but because most people know, so it's not good for them because they have problem. Somebody with GERD, somebody with gastritis, and then it hurts them. So most of them, they cannot take the answers. So that is the reason why most of us don't want to take the pain medication. But who say pain, back pain, something which is very common among Ghanaian women, and then especially health professionals. So I don't know.
Because health professionals, especially nurses, and then nurses aides and then patient care associates, move patients. Into Sunday meaning also a back pain. But the thing they said, we need what try be nenya juma. And I think so no now we taking a course look at try this out. Then one next step and then so we'll try baby that can possibly work, and that could be surgery. Surgeries are most surgeries are made and lasted 2 hours and go in more than 2 hours. At most 4 hours. And most patients almost feel within 3 days after surgery. Into survival from surgery are very, very it's a patient who was surgery. I've never actually seen that. Patient who was surgery. Only time I met who signed a patient or severe brain injury, yeah, didn't echo or not all bleeding too much. No, no.
No, I'm not talking in terms of if I
sure.
But sometimes back in back surgery we are. Many people they end up say and I say they can't be straight or it affect them. That's what I'm talking about. So it's very scary when it is suggested for people to go for the back surgery.
I totally and mama met the all kind of thing, may it go on my more back pain and I make I do stretches, I do yoga, I do exercise and near my bebrea may just to prevent back pain. But may consider surgery that the only time I may consider surgery is a madam pass what I mean to me move my try be pain and go away. And that's the only time I may try surgery. And me, that's the only time I may recommend this surgery. Say, what try be and work here. Then surgery may be it. Because the other thing that's all OTA said, small problem, that's a one fix here, it may lead to big problems in the future. Say small arthritis and it causes pain. Now say you feel honoma, you beat me a level to 90. I won't feel back pain deal. But obeying to me guarantee was a promise or no. And I make us say so try baby and juma. Any be a surgery and the right thing for you. So consider it. Say pain in your end get it better.
Okay, but that's it. I don't know.
Doctor, there was Dr. CCJ, and another questions by the minister Munina.
That's one more time.
Your opportunity said, remember why last question.
Okay. Okay, my simple son is say, and you say, Nipper or you're dead, brain dead. yeah, a be at me survive plan. As I had the engine super to bumpy. I may at least will be an adrenaline and then yet maybe a few or sabrum. This is happening.
When he said Mikaya in the beginning of the lecture, no, brain dead, and on the legal definition, when they said, well, see, once I pronounce brain dead, it means that, I mean, there's no chance that will be back. It's irreversible, permanent. And see, that diagnosis, as a permanent, it means that, well, your heart may be still beating or things like that, but it's only because of machines that are more connected to. But then yes, body, your chance that will be back. It's just that the brain, that's it, permanent.
Okay, all right, yeah, that's it.
But answer me, Pacho, make my Dr. Justice as Mama clarify, Yamama.
Okay,
Dr. Justice, I'm said last Wednesday or Thursday, I will present spinal cord. You also talk about real cases, real medical emergency where surgery is the only option. Now, when you bring up the point, is simply you say, "Hey, Ghana for when you catch there, surgery your last option." One will be the medical emergency corner and doctor Casa Unya surgery Samuel or because no, I'm going to try physical therapy. Tim Pesa clarify point and you may yako. Despite what you just said, there are certain rare cases where surgery is the only option. For example, your low back pain, all of a sudden, I can't pee, I can't do anything. I can't even feel my legs. Do we have to go to physical therapy for this? Or it's just a surgical emergency?
And there's something your friend called Aquino Syndrome. I know some people are tip before. Cauda equina. It means horse's tail. Also, me check my spinal cord and no bottom part and very low part and I say a horse ni tail. Sa part no, sa nerves in there, fast part in there, a supply or bladder, a supply or bowels, no rectum, a mouth feely or private area no. Sa nerves in the air compressed. Now say would lose ability to urinate, would lose ability to use to control or bowels and a emergency. Also call ER right away because one caught now say otna so now shesu will fear no good will ever come out of it. Okay, because Sanya man be permanent. I feel intimate reversible. Inti se unya sa symptoms and I also co ER. So especially you'll be our back pain. Who doctor for and I say unya back pain. Now I feel all of a sudden untimin P untimin Johnson and I feel so also call hospital right away. The next thing they say start to get weakness, meaning says when nine and I say on sa move also call ER right away. So sa 3 symptoms urine, bowel, weakness. So unya sa nema way in be also call a ER not all my doctors in the show. And last thing they say yeah what back pain no. If you all know say many surgery. What can sometimes happen? They say nerve get it pinched for so long. Some muscle nerve and supply and get it weak. Now if it was start to lose muscle, your friend atrophy. Into show on back so chain other one. So starting who sa symptoms and also go a doctor because it get it worse. Ubit me get it to a point untimin you on sana now on 90 bill.
Pacho, me Pacho, answer the Mr. Now, put me unya numbness and so most people also say unya sports about a pain. Put me a numbness from maybe I will type call even to your toes, and most especially when you are on the toilet seat, and as I would call a toilet, so who's a numbness no. It me back. What is the causes?
Well, also, mature my nerves and if I were chihonum no, if I buttocks no, your friend a sciatic nerve no. The otinase for too long, otisa nerve and so. On make us a memo, mude wallet to show omubotoma, omutinake move for 1 hour, once omunaya ye numb. Me papa eka same story in China. So you wallet in through bottom or symptoms in the same thing. What the toilet and so a toilet and a press it sa nerve no. Na fe nune ma wona ne eye number no. Oh, but sorry I won't say call. Oh, sa nerve na a press it was spine a cause or 9 or 9 a number no.
Pacha will me one question. Me Pacha me question is say me wa back pain. Me question me say me chidom no. Akwa ama ehu baby afuru kakra oni say misa no. E na me hwe ase na kwa ye na ka say ke straight. Nti wana straight ti ni nyina e kwa ko. Nti I say tokro kakra e wo mechi. Now one eno me da anado a na anansi achimen sa nyina na yetitiri ebu oso amenai me pacha eno na ekoso sa de na
very hard for me. They say yes because meaning the ekoso wachi. But based on their work it may be related. Already diagnosis say baby a chia or wachi. Now say pain and numbness no on 9 more. That means that baby cause or honor.
Okay. Because me kukura me sa die mu chakra na me sa na yititiri jimi jai ade no efo.
Say omu kacha o say a baby born na chia no e wo o komo ana say wachi.
E wo machi me spinal cord no machi akometo line mo kometo
because a honum na problem no why inti affected one sa inti e was say o find out reason into on sa yes no what am I say yeah because ABI also instead so mo best scan or chino also mo scan or con.
But I am mammy con ya me ya this I am not this wanda me con ya me pushing Ghana ya castle madam me con so madam the console. It is for me to turn me corner. Sometimes I was turning the whole body. Instead I can let turn the corner. It turn the corner ya me ya me turning the whole body.
Yes, and based on their work or symptoms no on some, which means say issue ni if you was spinal, if you want or come hono into or MRI and a wound here. What am I saying? Yeah.
Mr. Danso. Mommy, 1 minute. 1 minute. Ghana for no say. Ye ko hospital sir. Aya na one more person who condition wo woman. Bibia omusuro. Ebi kura MRI na doctor nso nko hye yinimo no. Osuro. Adra ade ma no. Omusa. Anyama bebre wo ho a mistakes bebre wo ho a ye Ghana for no. Ye ko hospital ayeye. But some yes and can be woo yache. And I do be me da ho a na nurse kura panier tintin bi no odiaba was it and I'm see for who was Margaret Sapon and I'm see dear no panier no mu was see menya me sugar coffee but sad diagnosis no na they call hospital or but my recover and to a tree or the banam see no man fang on me 1 year nurse what dress it is say obia o free fear but was a white jacket and I'm catching and said no on fan coming what the war me will become me so and until no ya call hospital mama ye hu condition mama ye musa questions a fear no and that's a boy ye bewu enti hu de wo fam na emwa doctor for no person de maye no mommy enye actually no mafro na anya na makachro medamase
no ante magi enso de wasepa and I'm sad that Dr. Priscilla Owusu-Frimpong so asepa Dr. Obi kakebi kana asana run it up.
Debbie, I think that overall, no, the whole point of topic, the terminal illness and life decisions, is that we have to make plans. Say try, say better organizing. What your plans are. And Fahun say Bia Ghana, and I said, it doesn't matter. At the end of the day, we don't know when we are going to die. We don't know how, but by all means, and see to prepare your family and to also make that whole process a more positive, as much as it can be. At the end of the day, and positive, but as much as it can be, try say some plans to make sure say process be easier, obey some of the stress every family so that
Yo, it was a pa na ade ba ko mse ki touch kakra but e binti ye be another time be ka ho asem organ donation and so ade a Ghana for yem pa ho asem ti pra yes I think say be another time e be ma yen so no e be ka disua ho na ya ka ho asem nyamba me gina asore nem na eda a doctor for a train safro mu nyina ase ewo na otrim dwumadi a omode abreye ene aboafo mbo aye nyina so da nyina wase da do e poster mai Destina edanase paye mi hana adwene paye edanase da mpenifo a mbo aye mpenifo bi e de omo adwene baye enyi ni se mpenifo nyina mse mebodi ma akwa ma go obidi etu mu nyina no da mu nyina wase ne da Dr. and Mrs. Osetutu the masepa Mabwai and Badishano kama because I'm a friend last minute getting about 3 weeks to the time but muditum a boy and the doctor's who was back the car and the nano echo kama said the every start Dr. This is also J and the WASIP we are very busy. I mean that send the crowd to Sabai and boy and Dr. Thompson, and so then I say, Marian, which was the doctor also and that's it. Munina, the massive. You said the feminist artist as after my most I back. My money, I bet check at the shade. She said, as a mountain, I mean, you may dear no. Yeah, what's the you may dear no. You knew cry, and at the end, you the unit, and still not at that. Now, for every Sunday, we are there, it's I. We have and so at the back, changing now, and the messenger, I'm a first header at a call. And a project, so was so that oh, now we are yes, we are some idea.
Yo, I'm sorry, Obia Mintini. Hello.
Doctor says
Yo, when you miss someone, Pastor, any bravo TV, not as a for name. No, it's where you can. Remember, be a free bag of it.
Cooking different types of recipes. Like I want to learn how to actually do it professionally.
Who say I program be to say that. Na example for amudi may yachi. In fact, me also pam chow. Yo, and until someone, when fast there, PSC man for especially Mr. Dansoni, Dr. Priscilla Owusu-Frimpong and company. Na mon yes, if it's first Ghana, mo papa ni mo amenum niye. Na what we munipa bebre benefit more than necessary kura wo mo ho. Na dia anke kodo anke ntimi nyeska akura. Again, me personally, it just say many agia na msem mo ma we nye last. Ye di kan ye msem mo baba bie mo abeboa mo papa no se enyinyi ni mo amenum. Na disua se be mo yen akoye nin kakra amam. Afe edi asafo ejina asafo mpanyifo ne asofo no osofo anamu dam ase bebre asafo maya dam ase the whole week no monitor ye no not a single night I yen over 100 and something one bin si sa dakura anti e chese ye ni gisa di ho pa ti dam ase some participate afe pastor si emfa empa bon santa mochiri minim se mrebe ma kwan di anka me bom pa ye tie said ya no pay we ya so no obetche different thing enti no ye na nyame aside wa ya ma asafo no enti mo me mom pa ye otu fu asafo awrade enyame ye dasio o ya ma first Ghana na otwi mu nwanwa ye nim ye se wo no wa ye sa enti de asua bia me mfa nto ho na ye mfa nwasa ye srem na emwo ho bra wo mo asia hwe adidie yie wo mo asia ye exercise I see a check it out, maybe a face secrecy or our real assignment, yen free. Now I'm fat or you'll be a metrobus. Yes, so here, so, but you could be a few could do. And now, maybe, you know, see me in Shamia and watching now, yes, you didn't. Amen.
Amen. That was it. Then I remember, Secretary, as well as Secretary also, Paddy Frank, you say announcement to be a while. You say about 6 years, yes, I call general conference for last work with Shia Adusia. Meaning, say, who announcement be a person of the Mayania.
That's an announcement of one or the man. As a former within 10 minutes, no, Greater Conference Family Refocus Program, no, a Beshasi, a Brenner Swam, no, Yamram said. Made the link no up by a WhatsApp platform no so you click link and so I do be ko mo akoshe program ni that means try amen.
Amen. And Sakuma, the mom whisper.
Amen.
Amen.